Birth pain has been described as one of the most severe pain ever experienced by humans. No wonder it's very important that every woman take their time to find out about the options of pain management available during labor. This is because it is very important that a woman's pain be managed throughout the process of labor in order to ensure a better outcome for the baby and the mother. My advice to you is consider your pain management options now that the labor has not started, because this is the best time for you to think carefully to choose the best option for you. If you want to know about what a painless delivery is, stick around, watch this video to the end, because in this video, I'm going to be telling you what this type of delivery is all about. What are the importance? What are the complications? Who and who can have it and who cannot have this kind of method of delivery? So if this is something that sounds interesting to you, consider watching till the end, and do not forget to subscribe to my channel, because here I tell you everything about fertility, women's health, and everything health. If this is interesting, please keep watching and let's get into it. But if you're seeing me for the first time, my name is Peace Choize. I'm a registered nurse and midwife, and I currently practice with NHS in England. So let's get into it. So I will be telling you about a pain management option in labor known as epidural. I know most of you must have heard about it, but in this video, I'm going to be telling you a lot more which you may not have heard or known about epidural. Out there is a lot of misconception and fear about epidural, but trust me to give you the most accurate information when it comes to fertility, women's health, and everything health. An epidural analgesia is a numbing medication which is given by inserting a needle and catheter into the epidural space. So how this medication works is that it creates numbness of the spinal nerves and a band of numbness around the belly button down to the top of the legs, while still allowing this woman to be awake, alert, and still feel pressure of the labor, however, without any form of pain. Doesn't this sound interesting to you? Of course it does to me. And a whole lot of women has opted for these options. So let's go ahead to explore more about what this epidural really is and how it works. So let's talk about how this epidural is given. Before this medication is given, an IV fluid known as an intravenous fluid is started, and it runs throughout this procedure. So after it has been started, you will be asked to either sit upright while leaning forward or to lie on your side with your knees up close to your chest. When this has been done, an antiseptic solution will be used to wipe your back, as this helps to reduce the risk of infection. A needle is used to insert a fine plastic tube into your spine. This needle is known as an epidural catheter, and it is placed near the nerves that carry pain messages to your brain. When the position of this catheter has been ascertained to be in the right location, then the needle is removed, leaving just the catheter in the spine. After this has been done, a tape is used to hold that catheter in place just on the woman's back, and then connected to an automated pump through which this medication known as an epidural analgesia is administered. It could be administered with that pump which has been calibrated to deliver specific amount of that medication within specific periods of time, or when there is no such pump, it could be given manually. So this is how an epidural is given. So what happens after an epidural is given? After the administration of epidural analgesia, it begins to work between 10 to 15 minutes of administration. And most women tell us that on receiving this medication, they feel no pain at all. For other women, they feel so relaxed that they even feel drowsy or sleepy while in labor. So you can imagine that. That's why I told you earlier that this is really interesting, considering the amount of pain that comes with labor, and you see such woman sleeping. That is the power of epidural. Now, when a woman receives epidural, Such women are usually encouraged not to go to the toilet to wee or to have a poo. Rather, a bedpan is given to them because an epidural could make you drowsy and that can increase a woman's risk of falling. So it's a caution for women who are under epidural analgesia. So at what point can a woman be given an epidural analgesia? Well, it used to be that there are certain times when an epidural can be given at certain periods of labor. However, recently, an epidural can be given at any time in labor as long as it is not very close to the time the baby is just about to be born. So it can be given very early as soon as the labor starts, but not so late, maybe when the woman is up to 8 cm or 9 cm. It is really not advised to give an epidural at such points. So if you want an epidural, it's best to ask for it as soon as you get into labor. At this point, I'm going to be telling you the advantages of having an epidural. Well, the greatest known benefit of an epidural is its potential to help women achieve a painless delivery. So the next importance is that it motivates a lot of women to go on and have a normal vaginal birth when there is no indication for a C-section. Also, it helps to reduce the chances of having postpartum depression. In addition to that, having an epidural helps to lower stress hormone levels. And if for any reason a woman eventually needs a C-section while on epidural, it can be converted to an analgesia used in C-section, probably by topping up with some other forms of stronger pain medication. So, all of these and more are the advantages of having an epidural, a painless delivery. At this point, I'm going to be telling you the side effects of an epidural analgesia. Oh yes, there are side effects because this is a medication. Just like every other medication, there are side effects. So the number one side effect of epidurals is that there is a risk of having nerve damage. And this usually occurs when the needle is inserted in the wrong location. However, the good news is that when this nerve damage occurs, although it can cause some muscle weakness, it is temporary and reversible within a few days or weeks. So it's not something that when you get it, it becomes the end of the world. No, it is reversible. The next side effect is that epidurals could lead to a drop in blood pressure. And when this happens, it can be treated by administering intravenous fluids. Another side effect is that it can make pushing difficult. Just as I mentioned earlier, it can make it difficult for the woman to push as much as she's expected to do, and this could lead to the use of vacuum or forceps delivery. The next is failed or one-sided relief. That's funny, isn't it? Despite how powerful this medication can be, for some unknown reasons, it fails and doesn't work in some women. Next is it could cause difficulty in emptying the bladder. Some women on receiving epidural find it difficult to empty their bladder, and in this situation, they are given a catheter to help empty their bladder until the effect of this medication wanes off. Then they can recover fully and pass urine just the way they used to before they went into labor. And finally, epidural could lead to low-grade fever, heaviness, or tingling sensation in the legs. So all of these are the side effects associated with having an epidural. So it is very important that you know all of these side effects and decide if you still want to have a painless delivery. So it won't be nice for me not to tell you about those who shouldn't have an epidural. The number one person who cannot receive an epidural are people who have a blood infection. The next are people who have infection in their back. And also, people who have low platelet count are also not expected to have epidurals. Next are women who are on blood thinners. Next are people who the anesthesiologist could not locate their epidural space. Yes, giving an epidural requires a lot of skill. And if the anesthesiologist fails to find where your epidural space is, he is very, very unlikely not to give you that epidural analgesia. And if you are bleeding profusely, you will also not be qualified to have an epidural. And finally, but not the least, if your labor is seen to be moving too fast, an epidural will not be given. This is because administration of an epidural requires a lot of preparation because it is given under a sterile technique. So that means all equipment must be sterile and arranged. And before all of this preparation is done, it takes quite a lot of time. Even location of your spine might also take a while. So if under the discretion of the anesthesiologist, he finds out that you might deliver this child before this epidural is administered, they might decide not to give it to you, even if you request for it at that point. So all of these are the people who cannot have an epidural. If you've ever had an epidural in the past or you're planning to have it, please tell us about the experience and why you would like to have an epidural down in the comment section. I will be happy to read them. If you've also got questions regarding epidural, kindly leave them in the comment section and I will try my very best to answer them. Thank you so much for watching. Also, do not forget to subscribe to my channel because it means a whole lot to me. Give me a thumbs up to show that you really enjoyed this video and you got benefit from it. Thank you for watching and I'll see you in my next. Bye for now.